Chronic kidney disease, or CKD, is a silent predator that lurks in the shadows, affecting millions of people worldwide. With every tick of the clock, this progressive disorder continues its relentless assault, resulting in a slow and steady loss of kidney function over time. The two most common culprits behind CKD are diabetes and high blood pressure, often silent themselves until it's too late. But the effects of CKD go far beyond the kidneys. It can lead to serious health complications, including cardiovascular disease, anemia, and bone disease. The grim reality is, CKD is a major cause of mortality worldwide, with a higher risk of death than many cancers. It's a battle many are fighting, and the stakes are high. But what if there's more to this story? What if the eyes could be a window not just to the soul, but also to the state of our kidneys? Intriguing, isn't it? Let's explore this fascinating link between CKD and the thinning of retina and choroid layers. Did you know that the severity of chronic kidney disease, or CKD, could be linked to the thinning of retina and choroid layers? This might sound surprising, but a recent study has ventured into exploring this fascinating connection. The understanding of this link could be a game changer, providing new insights to improve the treatment and management of CKD. This is not just about connecting the dots between two seemingly unrelated bodily functions, but about advancing our knowledge in healthcare. Now let's dive into the details of this intriguing study. Chronic kidney disease, often abbreviated as CKD, is a condition that affects millions of people worldwide. It's a progressive disorder, a slow and steady loss of kidney function over time. Our kidneys, those two bean-shaped organs in our lower back, are responsible for filtering out waste, excess fluids, and toxins from our blood. When functioning properly, they help maintain a healthy balance of water, salts, and minerals in the body. But when CKD strikes, this functionality is compromised, leading to a buildup of harmful substances in the body. Now let's delve into the causes of CKD. They are numerous and varied, but the two most common ones are diabetes and high blood pressure. Over time, these conditions can damage delicate kidney structures, making them less effective at their job. And what's more, the symptoms of CKD often don't become apparent until the disease has advanced, which makes early detection and treatment a challenge. CKD's impact on the body is profound. The condition can lead to serious health complications, including cardiovascular disease, anemia, bone disease, and in its final stage, kidney failure. It can also lead to fluid retention, causing swelling in the legs, ankles, or feet, and difficulty in breathing. The prevalence of CKD is staggering. It's estimated that nearly 10% of the global population is affected by this disease. That's almost 750 million people. With such high numbers, it's clear that effective strategies for prevention, early detection, and treatment are critical. However, CKD is more than just a kidney disease. It can impact other organ systems too, creating a network of related health issues that can complicate treatment and management. One such connection, which may seem surprising, is between CKD and the eyes, specifically the thinning of the retina and choroid layers. Now, how does CKD connect with the thinning of retina and choroid layers? Let's find out. A recent study has brought to light an interesting connection between chronic kidney disease, or CKD, and the eyes. Dive into the world of medical research with us as we explore this study in depth. This exploration began with an intriguing question. Is there a link between the severity of CKD and changes in our eyes, more specifically in the thinning of the retina and choroid layers? The researchers embarked on their journey with a clear methodology. They started by compiling a list of patients diagnosed with CKD and then proceeded to closely examine their eyes. They were specifically interested in two parts of the eye: the retina, which captures light and sends it to our brain, and the choroid, a layer filled with tiny blood vessels that provide oxygen and nutrients to the eye. In order to quantify the thickness of these layers, the researchers utilized a technique known as optical coherence tomography. This is a non-invasive test that uses light waves to take pictures of your retina. It's like having an ultra-detailed map of the eye's interior at your disposal. So, what did they find? The results were quite revealing. They discovered that as the severity of CKD increased, these layers in the eye, the retina and the choroid, were progressively thinner. That's right, the worse the kidney disease, the thinner these layers became. But what does this mean? Well, the retina and the choroid are crucial to our vision. The retina is like the camera of our eyes, capturing images and sending them to the brain. The choroid, on the other hand, is like the life support system for the retina, supplying it with vital oxygen and nutrients. So any changes to these layers could potentially affect our vision. Now you might be wondering, how does kidney disease tie into this? It's a valid question. The kidneys and the eyes might seem unrelated, but they are both vascular organs, meaning they're rich in blood vessels. CKD often leads to vascular complications, which could potentially affect other vascular organs like the eyes. But remember, this is just one study. While the findings are compelling, more research is needed to fully understand this connection and to determine whether the thinning of these eye layers could potentially serve as a marker for CKD progression. So, what does this connection mean for those with CKD? The findings of this study have far-reaching implications. So let's delve into what this could mean for the future of chronic kidney disease, or CKD, management and treatment strategies. Firstly, the correlation between CKD severity and thinning of the retina and choroid layers could potentially revolutionize how we approach early detection of CKD. Currently, CKD is often diagnosed in later stages, making it more difficult to manage and treat. But imagine if we could identify CKD in its early stages through something as simple as an eye examination. This could allow for earlier intervention, potentially slowing the disease's progression and improving patients' quality of life. Now let's talk about treatment strategies. Understanding the link between the eye and CKD could open doors to new therapeutic approaches. For instance, if we can understand why CKD is causing changes in the eye, we might be able to develop treatments to counteract these effects. This could not only help manage CKD, but also prevent or delay associated vision loss, providing a twofold benefit to patients. But, as with all scientific endeavors, this study also highlights the need for further research. While the connection between CKD and eye health is becoming clearer, there are still many unanswered questions. For example, what are the exact mechanisms behind the retina and choroid thinning in CKD patients? Are there other ocular changes associated with CKD that we haven't discovered yet? And most importantly, how can we translate these findings into practical, effective treatments and interventions? This study also underscores the importance of a holistic approach to healthcare. We're beginning to see that the health of one organ can reflect the health of others. This could prompt a shift towards more integrated healthcare models, where we're not just treating individual symptoms or diseases, but looking at the body as a whole interconnected system. So, while we're still in the early stages of understanding the relationship between the eye and CKD, it's clear that this research has immense potential. As we continue to uncover more about this intriguing connection, we can hope to see advancements in CKD detection and treatment strategies that could significantly improve patient outcomes. This study is just the beginning. It opens up new avenues for understanding and treating CKD. And we're excited to see where these paths will lead us in the future. To sum up, this innovative research has illuminated a previously unexplored connection between chronic kidney disease, CKD, and the thinning of the retina and choroid layers of the eye. The study has offered critical insights into the holistic functioning of our body's systems and underscored the importance of comprehensive healthcare. By revealing a strong correlation between CKD severity and changes in the eye, the research opens up non-invasive monitoring possibilities for CKD, thereby potentially improving patient outcomes. This profound understanding of CKD brings us one step closer to improving the lives of those affected by it and paves the way for future research. It is a glowing testament to the relentless pursuit of knowledge and the transformative power of scientific curiosity. As we wrap up today's video, remember that knowledge is power. It's our collective responsibility to spread awareness about conditions like CKD, so we encourage you to subscribe to our channel and share this video with your friends and family. Stay curious, stay informed, and let's make a difference together.